Thank you so much for being with us throughout today. It was wonderful to see you in our audience as we had that very fantastic panel discussion this morning. Diaphragm and renal care, how it's being redefined and how it's really unique in the provision that it's been providing here in the UAE and in the region. And the reason I put the emphasis there is diaphragm, M42, and plugging health gaps. That is plugging the renal care health gap there that we discussed this morning. Let's just set the context for our audience. We have wonderfully health professionals and experts, but people who are new to this subject matter as well. So first of all, where are the health gaps? Exactly where are they before we talk about scaling up to address them? Dimitris?
So I think universally the health gaps are in access of care services, in precision medicine, in being able to follow the pace of medicine and deliver it across the globe. There are gaps in prevention, big gaps in prevention, especially renal care. We find many patients that they crash on dialysis, as we say. They are not found earlier, and it has to be, and then the health situation deteriorates. And there's a gap in specialty care as well across the globe, I would say.
Fantastic. So access, provision, and making it more universal and standardized care, not
Correct.
just here in the UAE, but across the board as well. Fantastic. Dr. Maaz, if I may bring you in, we had that wonderful panel discussion that you've just finished moderating. So this seamlessly builds on from what you were discussing there, AI helping to fill those gaps in health.
Thank you, Aman, for that question. Before we get into the answer, into answering that specific question, if you just zoom out and look at where the gaps in healthcare are, just building on what Dimitris mentioned. If you look at the developed part of the world, which is, you've got health systems which are overwhelmed with aging populations. You've got doctors who are being entrusted with lots and lots of tasks which take time away from their patient care and are overburdening the setup. On the other side, if you look at the developing part of the world, most countries have a sheer access challenge in access to skilled workforce, skilled workers. Now, AI is one of those solutions that we've been working with, which actually plugs gaps across based on how you use it. So for example, at M42, we've been working on clinical AI assistants. We're using M42, our large language model, to build clinical AI assistants that can help doctors understand information better, make clinical documentation, so that we can avoid taking their time away from patient care. And once we've given that time back to them, they can invest it back into making better clinical decisions using AI for personalized medicine and others.
Fantastic. So it's empowering the doctors, people on the front line, giving them the time back. And I think the astute point you make there, Dr. Maaz, is a nuanced point, actually. It addresses the reticence that we still see across the healthcare ecosystem when it comes to AI. There is embracing, but there is reticence there as well. And you emphasize it's about giving time back to people. Ruthy, welcome. It's wonderful to have Microsoft represented here. When it comes to the UAE, the relationship with Microsoft, it just gets stronger and stronger. I feel every week there's a wonderful new headline giving us a wonderful insight into the collaboration there. Let's just speak widely. In your opinion, in your perspective, reflecting back over the last few years, how AI is revolutionizing healthcare systems?
Absolutely. So thanks for hosting me here. The partnership with M42 is just a very strategic one. Globally, I would say Microsoft has been focused on healthcare for over 30 years. During COVID, we really saw that doctors, clinicians wanted to have their systems be able to empower them. So we made our platforms speak healthcare. And then Gen AI came, and AI, and the era that we're in now. And actually what we're seeing now is that AI really empowers the clinicians, allows us to access data wherever it is, in whatever format it is, because suddenly we can access unstructured data, where we couldn't do that in healthcare before. And that's why AI is such a big promise and such a revolutionary technology in healthcare today. Because 97% of the data in a healthcare organization is actually not used. 97%. It's unbelievable.
That's incredible. And it allows me to seamlessly bring in Dimitri to talk about some of the hurdles and the barriers. But just to follow up on that, why? Why 97%? Is it because we don't have the systems in place to analyze the data?
It's because we have many systems in place.
Too many systems.
Yeah, so there's a lot of
Too many
systems. They're very siloed. The data is in many, many formats. And what AI and Gen AI allows is to access data wherever it is and whatever format it is, and allows you to bring the data virtually together and actually extract insights and really create a data-driven healthcare system.
So 97% before AI is applied.
Exactly.
And when AI is applied?
So that's what, we're trying to increase the number of the access. We talked about access. It's a lot about this kind of access, but improve and increase the data that is accessed and drives better care.
Fantastic. We're going to come back and unpack a lot more of that, Ruthy, with you. Dimitri, hurdles and barriers that you've seen yourself that have been overcome and ones that we still need to address.
Yes, I think if I will draw the diagram example, I think we have been able to overcome most of these barriers. Maybe for the audience education, let me say that diagram has been in a massive digital transformation in the last 6 years. And today we have digitalized all the workflows across 460 clinics in 24 countries. We have a common EMR system. We have digital tools that standardize care the way it is delivered, and we collect a massive amount of data from our patients. Actually, every day, to every clinic of ours, at every moment, we collect live a series of medical KPIs. As Dr. Fernando Macario said early on, this gives a patient care evaluation. Now, on the back of this data collection, we deployed the AI at scale, which is the subject of this panel successfully. I will give a couple of examples for the audience. I think one of our most successful examples is the thrombosis prevention model we deployed. Today, thrombosis of a dialysis patient is one of the most serious events. We have something between 0.1 to 0.5 episodes of thrombosis that we try to avoid. With this model, which has great precision, we reduce the thrombosis events by 25%, and this drives longevity and quality of life, especially because by addressing this, if you don't address the problem, then the patient has to connect with a central venous catheter, which ends to up to 30% reduced longevity. Now, another model is that we manage mortality. We can predict hospitalization again with a series of data, and we can address an event before it happens, which allow us not only to provide a better quality of care, but we contain the cost for the payers. So what is behind that, coming to your question, so how you break boundaries? I think it's a number of factors. I think that obviously, starting from the basics, you have to have the proper infrastructure in place, from data pipelines to computing power to integrating with your systems. You have to have the right data in terms of quality of data, quantity of data, and also diversity of data, as different ethnicities have different characteristics. And this is a struggle from many organizations that they operate just in one place. Then it's extremely important to have the buy-in of the physicians. In our case, we involve them early in the process. They stay in every step on the process, and then in the end, up to the deployment. And it's extremely important that your model is to be trustworthy, which means to be explainable, fair, and deliver reproducible results, because it's the only way for the physicians to trust the model. And in our case, I referred before to the thrombosis prediction model. When it makes a prediction, the physician has access to the inputs based on which the prediction is made, so they trust the model. And recently, we are using LLM models to interpret these models. And I think this is another area where I think that LLMs can act as AI tutors to train the physicians and change their mindset. Maybe the last point to make is that as you are scaling up these models, and we're a premium example in healthcare today, it comes with many ethical and legal complexes that you have to comply, obviously, and address, especially as you deploy these AI models in different cultures and in different settings across the globe.
Absolutely. And I think there's some really key points that you make there. You talk about the infrastructure needing to be in place, which Ruthy was speaking about there, the quality of the data, which echoes Dr. Maaz's point, and the buy-in of physicians, as you say. So these are really kind of key points to elaborate on. I'm going to come to you in a moment, Dr. Maaz, because we did have that wonderful session with you. And just to bring in Ruthy to get the Microsoft perspective on this, when we talk about the collaboration between companies and governments, private and public sector, what should we be seeing more of? Where's the critical areas of growth when we speak about scaling up AI?
It's a great question. So what we're seeing with the collaborations that we're doing across the region and actually globally is that when there's a strong partnership across, from the Ministry of Health level to the provider level, to the payer level, public and private, really driving the need from the clinician level, the patient level, also the operational level, and bringing the tools to empower. So, like we said, bringing more time to FaceTime. So one of the key solutions that we're seeing now is ambient clinical documentations, right? We all go to the doctor and they type, right? Bring that eye contact, right? Just by a system that listens to the discussion and plugs everything into the electronic medical record. Or giving a doctor a next best action, right? Because all the data is there, like we said. Usually all the data is in our head, but how can we leverage the data that's everywhere to extract insights and to suggest a next best action? It allows for a faster clinical consultation, but also better care. Or population health, that's a really big one, predictive medicine. And then, what we're doing very strongly with M42, the fact that there's a very good, strong data, multimodal data. I think this is very important to understand because the data in healthcare, it's multimodal. It's various types of data in different formats. The fact that we can bring everything together and extract insights, that's the revolution. So M42 have that together with assets and taking that globally, that can really be a game changer. And that's where success lies.
Absolutely. And before we talk about what M42 are doing, in your perspective, representing Europe, Middle East, and Asia for Microsoft, what's so unique about what's happening here in the UAE and with M42?
I think referring to what Dimitris was saying, the quality of data and the accessibility to data, I think that's key. The fact that there's a lot of collaboration and openness and willingness to really be at the forefront of care, I think that's really a unique value proposition.
Fantastic. And that beautifully ties me up in order to line up Dr. Maaz to give us more of the detail. Dimitris mentioned earlier one of his final points being LLMs and how they play a key role. The previous session delved into it. But in case some of our audience members weren't participating in that, bring us up to speed, Dr. Maaz, exactly what's happening here at M42.
So at M42, we built Med42, which is a clinical large language model. I think I mentioned that in the last discussion as well. Having a clinically accurate large language model, having a capability like that provides us an engine with which we can drive multiple different applications and focus on very specific use cases. Now, building on the same use case conversation that we've had, how do we empower the clinicians to have more face time with the patients? How can we give time back to them so that we can then expect having to do them more tasks? In today's complex workflows, asking a physician to do one more task is a tall order, is a tall ask. Before we do that, we need to kind of make that time and capability available. And that's, I think, one of the first targets that we are doing. How do we improve the quality and the intensity of human touch in healthcare? How do we give that human touch back to the doctor, the capability of investing that human touch back to the doctor? And that's what we're doing with Med42. We are using LLM mod Med42 to build a clinical AI assistant which can help doctors summarize information, summarize evidence, but most importantly, start with, can I actually reduce some of my tasks? Can I actually capture information, have it, record it, so that I can then find the time to reinvest that, take better decisions, and that's where we are largely currently focused on. So the first is bringing human touch back into healthcare. The second stream of work that we're doing is how can we enable clinicians to practice at the top of their license. For example, I'll give you an example of Iris TB scan that we've launched. Now, it's an AI-based technology that's built to screen X-rays for tuberculosis. We've started with tuberculosis, we can apply it to other conditions as well in the future. But what it does is, of a stream of 2,000 X-rays that come to Capital Health screening every day, majority of them are normal. But that's having to look at 2,000 scans takes away time from the clinicians, right? What if they could focus on those 20% scans that need a medical expertise, that need them to focus and invest proper time to give their expert opinion? Now that does two things. One, it reduces the diagnostic fatigue, therefore the risk of errors, and also help the clinicians focus on what matters, the cases that will matter, and allows them to see a lot more cases than they would be possible. Now that's very important from two perspectives. While we are building this over here, we've got the amazing opportunity to cover a very vast audience. So we build this over 1 million scans covering people from around the world. Remember, you're based in the UAE. That's an opportunity you have in the UAE. Which essentially means this could be applied anywhere in the world, and it could be applied to A, either improve the efficiency of doctors, or B, in places where there are no doctors available, in the scarcity of doctors. You see the same technology playing both roles and addressing both challenges of overworked clinicians as well as understaffed hospitals.
So really wide-ranging and wide-reaching impact. I think that sounds like a very empowering vision. You mentioned there repeatedly the words that Ruthy and Dimitris used there about providing time back to people on the front line, empowering them, giving them agency. And M42, just for somebody who doesn't know, we first talked about it here at the Arab Health last year, didn't we, Dr. Maaz? So how long ago was it created, and how is the iterations continuing?
Sure. So the first model was launched in October 2023, and that's the model that scored the 64% on the clinical and the USMLE scale. And we've used that model to test for different applications. Over the last 1 year, we've released a second version, which is based on a large language model. And this model has scored about 94.5% on the USMLE score. These results are available in the public domain for verification.
Okay, it's really good to know that. Now, has anybody got any questions for my audience? I see that... Any burning questions? Fantastic. We have a very esteemed audience member who's going to be taking to the stage later. Wonderful. Please introduce yourself to the rest of our audience and our guests.
Laila Abdelwaris, CEO of the diagnostic vertical at
Fantastic.
M42.
Welcome. I'm going to ask you to keep the mic really close because the volume is building up the crescendo for your question, please.
Thank you. Thank you very much for excellent discussion. I think one of the health gaps, the global health gaps perhaps, is mental health issues. And we're seeing almost an epidemic, particularly after COVID. We're seeing this in Europe, and UAE is not really very far behind in younger population. What can AI do to help addressing this?
Fantastic question. Thank you very much, Doctora. Thank you.
I can take
Yes.
that. So it's amazing that you asked that, and that was not an invited question. The beauty of mental health and the capabilities of technology is that mental health and mental health care is actually a language-based care. Gen AI is a language-based technology, and that marriage is very powerful. What we've done is we've worked with leading psychiatrists that told us, can we actually leverage Gen AI to create a conversational platform to give more time to the clinicians? Because an initial interview with a mental health patient can take up to an hour. So we created, together with a few clinicians and healthcare organizations, a mental health platform that creates a conversational discussion, pure natural language with a patient, and actually creates a summary and assessment of the mental health patient. And that allows the caregivers to prioritize, to understand what the situation is. And the amazing thing is that the patients say, I am listened to. It's amazing. It's really moving. So I think mental health is a huge promise.
And do you see with that particular model, there's been an iteration, because you mentioned Gen AI. Previous to that, was there a case where you felt that there was a limited and patients didn't feel that they were listened to?
I think there's a big difference here that generative AI, doesn't matter which models, but by the way, one of the things that we do is create a platform to allow many types of large language models, including M42, to be used in these solutions. So actually the idea is that you don't use one model, use many types of models, both generative and non-generative AI, and these technologies are constantly improving. So the ability to use the latest technology is there in the platform.
Fantastic, brilliant. Dr. Maaz, would you like to come in? And I think we have another question, yes. Can we get, we got a couple of mics. So Dr. Maaz, hold your point because it may be, let's give the audience a chance. So please, mics all the way up and introduce yourself.
So I followed first question. My question has two folds. Is mental health disease separate from neurodegenerative disease? This is the first part of it. And the second part is, can we only trust on psychiatric-based tests rather imaging-based tests?
Okay, who would like to address that?
So I think that's a medical question, and there's no physician in the stage. Apologies about that. So maybe we can invite Dr. Macario, who's there to answer the question.
Okay, we perhaps can take that on board. So esteemed audience, we may be asking one of our wonderful experts to speak with you directly off stage. We will make sure you get an answer. Please.
Thank you so much. My name is Nasir Idris. I am from in Chad, Africa Central. I am Director of National Digital Health. But I follow his question for his, I needed like to know the purpose are the future term in digital health and AI and Africa for foundation for investment, all the question and digital and telemedicine project for new generation. Thank you.
Cool. Did you, just to clarify, the question is, I heard a lot about digitalization, but just to clarify the one line of the question.
Investment for digital health and telemedicine for Africa, for in the Microsoft,
Okay, so perhaps we could address the wider application across the continent of Africa when we come to developing our AI models. Would anybody like to address that?
I mean, I can take it because Microsoft has a very big focus on creating and empowering Africa and bringing, by the way, huge access challenge in Africa. So how do we bring technology? Because everybody has a cell phone, but not necessarily a clinic. So how can we leverage the fact that you can do remote consultation with a specialist all over the world to any remote space? So telemedicine is a big one. We have a big focus on Africa as, how do we invest and bring the care and the best of care to Africa? And I think today the technology that's out there and the applications can really be game changers in how to really bring care to everyone.
Thank you for your questions. I'm afraid we are out of time, but my panelists are super approachable. So do catch them later and put your questions to them directly. I'm just going to say that's a really strong point you make there, Ruthy. It builds on what Dr. Maaz was saying, that in some parts of the world, it's not simply about scaling up AI to address the health gaps. It's actually addressing those traditional gaps in health provision. And this is where this synergy is just so wonderful. I'm going to give you all a chance, 30 seconds each, a call to action. We have health professionals, big players, people who are very enthusiastic, people who are new to the game. When it comes to scaling up AI to address health gaps, what would be your one call to action, Dimitri, and then my panels?
Well, my one call to action is that we should open-minded to embrace generative AI. Actually, there are three. We shouldn't underestimate the power of conventional machine learning, which is going to give the prediction of the results, and we should invest in infrastructure which will allow the quality of the data we need in order to deliver the outcomes.
Okay, so let's not underestimate, let's dream big. Dr. Maaz.
So the one thing I'd request is, in the pursuit of, we shouldn't lose the opportunity in the pursuit of perfectness, right? While we chase perfect behaviors, perfect outcomes from LLM, or any generative AI technology, we are actually missing out on some of the benefits it could offer us now, meaningfully help us now. And I think that's one thing I would say. How can we come together and understand what is meaningful use of AI that can have meaningful impact now versus a pursuit of perfectness?
So meaningful impact. Ruthy?
Very simple. Start now. Not tomorrow, not in a week. Start now. There are tools available. You have the data, you have the knowledge, whether it's operational or clinical or patient-facing, start today.
And I think that's a wonderfully empowering call to action that we can all get behind. And can you please get behind a big round of applause for my panelists?